I work in a section called the clinical engineering section, and what we do is research and development of devices, including introducing new technologies and methods into clinical service, and custom devices. And we support clinicians interested in developing or adapting instruments or carrying out proof of concept studies, including devices. Surgeons, anaesthetists, dermatologists, etc., physiotherapists. We also develop solutions to individual patients' needs, including equipment for surgical procedures. Now, in the NCAs for most hospitals, we have a growing backlog of surgical procedures, primarily due to the impact of COVID. But we also, of course, still have underlying pressures, such as aging populations and more complex needs. So, practically, what can we do in the short term? One potential route is to introduce new technologies to help clinicians, surgeons, anaesthetists, etc., and carry out procedures and use theatre resources more efficiently, help them to plan the procedures to have the outcomes they want by using these new technologies and planning methods. So we set up a thing called 3D Spin. That's the Centre for 3D Surgical Planning and Innovation. And this is a project which is aimed at developing these technologies and trying to translate them into routine clinical practice. The main elements we use are using computers to carry out simulations, to do things like surgical plans virtually online, and then to combine that with modern techniques like computer-aided design and 3D printing to provide the tools the clinicians need to plan and effectively prepare for surgery. So once we have surgical plans, we can 3D print models to give the clinicians a better understanding of the physical nature of the procedure, and provide things like virtual reality and things like virtual endoscopies, again to provide them more information.